Hello, today we will be talking about Chapter 5, Social Reform in the Progressive Era. Progressivism was the first sustained reform movement in the U.S. that addressed a variety of urban issues. Early in the industrial society, majority of the workers were newly immigrated families. The climate was very unsympathetic to union organization, and few policies or programs existed to protect people. In the 1900s, government was dominated by patronage and who knew who with money. These people were relatively weak figures who would put down union demonstrations and cared little about reform. The Depression of 1893 caused a change in alliance from Democratic to Republican in many workers. Many unskilled labor workers joined the Fringe, a very radical political party, and although they did not succeed in government, they succeeded in organizing the unorganized, unskilled labor force, making them a threat. Milestones of the Progressives' reforms were a lot of regulations put in place at local, state, and federal level. These reforms created the social work profession. The services created at this time were workers' compensation, mothers' pensions, juvenile court, the Children's Bureau, and protections for female workers. Although the Mother's Pension program sounds sympathetic towards single mothers who have been widowed, divorced, or separated, this program gave pensions to relatively few women because of the strict requirements. Before juvenile courts, children were tried as adults and put into prisons, confining them from family and school. The Children's Bureau was established in 1912 and enacted legislation restricting child labor only to have it overturned in Supreme Court. This also helped female workers in their work environment. Workers' compensation eased the public pressure to improve safety, and people believe that this program helped employers more than it helped the workers. The health reforms that happened within the flawed capitalist model went as so. Nearly 20% of population were killed by epidemics. Public health reforms included health centers and communities offered new inoculations. Inspectors enforced sanitary regulations. And the issue was private physicians were funded by patients, so the poor could not afford those fees, went untreated, or got care from an underfunded, poorly staffed public hospital. The reforms and laws that had little effect on society. Reformers had legislative bias, procedural bias, and they also relied on local government to take lead on social reforms, which diminished their effectiveness. The Bull Moose campaign of 1912 showed how difficult it was to win as a third-party candidate in national elections. The Socialist Party was established in 1901, finding power at local levels. Women were very oppressed during this time, so they became key components to the progressive movement. They engaged in political action, securing suffrage with the 19th Amendment to the Constitution in 1920. African Americans in both North and South lived in severe poverty, especially in the South where federal efforts were ignored and Jim Crow laws were enacted. African Americans had strategies to cope with the adversity. They developed charitable projects, participated in church groups, formed their own settlement houses, and established hospitals. Alien land laws enacted in 1913 and 1920 prohibited land purchases and ownerships by Japanese Americans. Spanish-speaking population were very oppressed in the agricultural settings in cities in the Southwest. These communities organized mutual aid funds to provide the essential needs like insurance, funeral, and limited welfare. Immigration acts severely limited who was able to enter the country, with literacy tests and favoring Northern Europe. What we can learn is the federal government needs to address the national issues applying to social work.